The hush of Aurelius Medical Center's exclusive VIP wing shattered as Nobel laureate Dr. Yael Abramov convulsed, his brilliant mind abruptly plunged into a neurological maelstrom. Dr. Kenji Tanaka, chief of neurology, barked orders, his usual arrogance replaced by visible panic. Dr. Santiago Perez, renowned for his diagnostic prowess, stared at the baffling readouts, his confident facade crumbling under the weight of Yael's rapid, inexplicable decline. Top doctors, renowned specialists, yet utterly stumped. Tucked away in the organized chaos, a shadow among titans, stood Zara Kimani. A rookie nurse, her modest uniform blended into the background, her quiet presence unnoticed amidst the frantic expertise. She fetched, she observed, her youthful face betraying no hint of the unsettling familiarity she felt as Yael's symptoms worsened. The esteemed doctor's desperate whispers about an untraceable illness, an impossible pathology, washed over her. They saw an enigma. Zara, however, saw a pattern. Her unique, remote field experience, so easily dismissed by this elite world, pulsed with an inconvenient truth. The real crisis wasn't the diagnosis they missed, but the solution only she possessed. And soon, they would have no choice but to listen. Aurelius Medical Center was a citadel of medical brilliance, its chrome and glass facade reflecting the morning sun with an almost arrogant sheen. Inside, the air hummed with hushed intensity, a sterile symphony of advanced technology and human ambition. On the 6th floor, in the critical neurocare unit, this ambition was being sorely tested. Dr. Yael Abramov, a mind that had shaped modern physics, lay entangled in a web of 4 lines, monitors, and an increasingly desperate medical team. Dr. Kenji Tanaka, the chief of neurology, moved with the crisp authority of a general on a battlefield, his tailored lab coat a stark white banner of his status. His voice, usually a measured baritone, now held an edge of metallic frustration. Another brain biopsy, Dr. Perez. The parenchyma showed diffuse inflammation, yes, but no definitive markers for viral inclusion bodies, no neoplastic cells, no amyloid plaques. It's a ghost in the machine. Dr. Santiago Perez, renowned for his diagnostic acumen, stood hunched over a bank of monitors displaying Yael's latest brain MRI. The vibrant colors mapping neural activity flickered erratically, mirroring the instability within Yael's failing cerebrum. His usual bravado was replaced by a grim set to his jaw. The CSF analysis is equally unrevealing, Chief. Elevated protein, a mild pleocytosis, but no oligoclonal bands, no specific infectious pathogens cultured, no atypical cells. We've ruled out MS, Guillain-Barré, acute disseminated encephalomyelitis, Creutzfeldt-Jakob, even paraneoplastic syndromes. Her autoimmune panel came back broadly negative for the common culprits. He ran a hand through his perfectly coiffed hair, a rare sign of his unraveling control. It's like chasing shadows. Yael's condition was deteriorating with terrifying speed. Initially presenting with subtle cognitive deficits and transient paresthesia, she now exhibited profound neurological decline. One moment, she was lucid, albeit confused. The next, her eyes would roll back, her limbs jerking in brief, non-epileptic spasms. Her speech had become slurred, her motor control sporadic. Today, her left arm lay flaccid, unresponsive to stimuli, while her right twitched uncontrollably. Autonomic instability had set in, her blood pressure swinging wildly from hypertensive crises to alarming drops, her heart rate mirroring the chaotic dance. A faint, almost imperceptible reticular rash, like fine lacework, had begun to bloom on her abdomen, a detail easily missed amidst the more dramatic neurological events. Zara Kimani, a ghost in her own right, moved through the room with practiced quietness, her presence so understated it was almost an absence. Her hands, calloused from years of practical, often improvisational, care in the remote clinics of East Africa, handled the delicate equipment with a gentle precision that belied her rookie status at Aurelius. She adjusted in 4-drip, emptied a Foley catheter, and meticulously charted Yael's vitals, her gaze never lingering, yet absorbing every detail. Her modest uniform, a muted blue against the white coats of the specialists, was a uniform not just of service, but of invisibility. She heard every frustrated sigh, Every muttered hypothesis, every desperate declaration of untraceable, impossible, idiopathic. And with each passing moment, a knot tightened in her stomach. She had seen this before. Not in textbooks, not in the pristine, controlled environment of Aurelius, but in the dust and heat of a field hospital, under conditions that forced quick thinking and a reliance on patterns, not just protocols. She recalled a young Maasai girl, presenting with a similar constellation of rapidly progressing neurological deficits, baffling local shamans and foreign aid doctors alike. The rash, the fluctuating paralysis, the autonomic chaos, a chilling echo. We've explored every avenue, Dr. Perez, Tanaka sighed, leaning over Yael's bed, his face etched with rare concern. The extensive EEG shows diffuse slowing, but no clear seizure focus. Nerve conduction studies are inconclusive, showing only generalized axonal damage consistent with global encephalopathy, not a specific neuropathy. We've even set tissue for genetic sequencing, though I doubt it will yield anything in such an acute presentation. Zara paused, her hand hovering over Yael's wrist, taking a manual pulse even as the monitor beeped rhythmically. The subtle tremor in Yael's right hand, previously dismissed as an artifact of her unstable neurological state, seemed to Zara to have a specific rhythm, an almost cerebellar quality. The slight asymmetry of her pupils, too, was becoming more pronounced. The differential is shrinking to nothing, Perez grumbled, tapping his pen against the screen. At this rate, we're looking at palliative care within the next 24 hours. Unless we find something, anything. Zara cleared her throat, a soft, almost imperceptible sound that was instantly drowned out by Tanaka's next instruction to a resident. Undeterred, she took a small step closer to the doctors. "Excuse me, doctors," she began, her voice quiet but firm. "I've been observing Dr. Abramov's reflexes. The Babinski sign is now bilaterally positive, and I've noted persistent ankle clonus." She gestured subtly towards Yael's feet, half covered by the sheet. "And the nystagmus, when I checked her pupils this morning, seemed to have both horizontal and vertical components, suggesting a brainstem involvement that might not be purely ischemic." Tanaka turned, his brow furrowed, a flicker of irritation in his eyes. "Nurse Kimani, thank you for your diligent observations. We are well aware of Dr. Abramov's reflex responses. These are consistent with diffuse cortical damage. Please continue with your charting." His tone was polite, but his underlying message was clear: stick to your station. Perez didn't even turn, muttering, "The nystagmus is likely secondary to the overall encephalopathy, Zara. We've exhausted that line of inquiry." He dismissed her with a wave of his hand, already engrossed in reviewing a fresh set of laboratory results for inflammatory markers, which again offered no smoking gun. Zara felt a familiar burn of humiliation, but it was quickly overshadowed by a surge of urgency. They were missing something crucial. The reticular rash, the fluctuating focal deficits, the rapid decline despite aggressive immunosuppression trials that would have helped typical autoimmune conditions, it all pointed to a very specific, very aggressive, and very rare type of vasculitis affecting the nervous system. A condition where the immune system didn't just attack neural tissue, but the very blood vessels supplying it, leading to a cascade of ischemia, inflammation, and rapid destruction. And the only treatment she knew of, the only one she'd ever seen work, was highly invasive, deeply risky, and completely off their radar. She watched Tanaka order another course of high-dose corticosteroids, a desperate, broad-spectrum attempt to quell the unseen inflammation. Zara knew it wouldn't work, not for this. Not for the rapid, obliterative vasculitis she recognized. The steroids would only provide a temporary reprieve, if at all, while the underlying process continued to ravage Yael's brain. Her mind raced back to the Maasai girl, whose life had hung by a thread, salvaged only by a treatment so unconventional for the region, it had been deemed a last-ditch gamble. A treatment that Aurelius, in all its sophisticated glory, had likely never even considered for a neurological crisis. The tension in the room was palpable, thick with the scent of antiseptic and unspoken dread. Yael Abramov's shallow, ragged breaths filled the silence, each one a ticking clock. Zara's unease morphed into a profound sense of responsibility. Her quiet observation, her unconventional experience, was no longer a personal burden, it was Dr. Abramov's only hope. And soon, she knew, that hope would demand to be heard, regardless of the hierarchy, regardless of the dismissal. The top doctors were stumped, clinging to protocols that were failing, while the solution, quiet and ignored, moved among them. The sterile hum of the ICU no longer seemed a comfort, it was a monotonous drone accompanying Dr. Abramov's agonizing decline. Days bled into nights, each bringing a fresh assault on Yael's deteriorating nervous system. The initial tremors had progressed to focal seizures, small, violent electrical storms localized in different areas of her brain, leaving her bewildered and exhausted in their wake. Her speech, once a torrent of intellectual brilliance, became slurred, fragmented, then altogether absent, replaced by guttural sounds of distress. The EEG tracing, scrolling endlessly on the monitor, showed a terrifying progression of continuous epileptiform discharges, electrical chaos threatening to burn out her brain. Dr. Tanaka, chief of neurology, clung rigidly to his initial broad-stroke diagnosis of a rapidly progressive encephalopathy, cycling through aggressive immunosuppressive therapies, high-dose corticosteroids, then cyclophosphamide, then IVIG, each delivered with an air of absolute certainty, yet yielding nothing but transient, negligible improvements, quickly overshadowed by further regression. "We're seeing an unusual resistance, almost an atypical presentation," he declared to a room of nodding residents, his brow furrowed, but his conviction unwavering. His chosen arsenal of broad-spectrum immunosuppressants, while powerful, was proving ineffective because they weren't precisely targeting the specific, localized immunological attack within Yael's CNS. Dr. Perez, ever the brilliant diagnostician, pored over every imaging study. Serial MRIs showed expanding areas of signal abnormality, indicative of diffuse inflammation and edema, but no clear mass, no definitive infectious foci. The white matter changes are diffuse, nonspecific. "We've ruled out prion disease, viral encephalitis, even paraneoplastic syndromes," he'd rattle off, his fingers flying across the PACS workstation, zooming into minute details, searching for the elegant solution that always seemed to elude him in this case. His confidence, usually an impenetrable shield, began to show hairline cracks, betraying a mounting frustration. His detailed analysis, while comprehensive, remained confined to the established differential diagnoses, unable to leap into the realm of the truly obscure. Zara watched, her heart a leaden weight in her chest. Each failed treatment, each new, distressing symptom in Yael, was a reverberation of the Maasai girl's struggle. The rapid, unyielding progression, the shifting neurological deficits, the utter lack of response to conventional immune modulation, it all screamed progressive neuro-autoimmune vasculitis to her. She recognized the peculiar dance of antibodies attacking the delicate vasculature of the brain and spinal cord, leading to ischemia and inflammation in a chaotic, unpredictable pattern that mimicked a dozen other conditions, yet was distinctly its own. The systemic immunosuppressants, designed for broader autoimmune conditions, were failing to adequately penetrate the blood-brain barrier to clear the specific, potent autoantibodies accumulating within Yael's CSF. One morning, during rounds, Zara cleared Yael's secretions. Her gaze fell on the subtle, petechial rash just visible on Yael's neck, almost hidden by the gown. It was so faint, so easily missed, barely a blanching erythema. Vasculitis. Her stomach clenched. This wasn't just central nervous system inflammation, it was a systemic component, however subtle, corroborating her internal diagnosis. "Dr. Tanaka," Zara began tentatively, her voice barely a whisper, "have we considered any microvascular involvement? Perhaps a more systemic autoimmune component that's presenting primarily neurologically?" She knew the rash was too small, too fleeting to be noticed by a casual glance, but she had to try. Tanaka, without even turning from the monitors, waved a dismissive hand. "Nurse Kimani, we've reviewed the full panel. No systemic markers of a classic vasculitis. ANA, ANCA, complement levels are all within our expectations for severe inflammation, nothing indicative of a primary systemic vasculitic process. Our focus remains on the encephalopathic component." His tone was patronizing, effectively shutting down further discussion. Perez merely grunted, engrossed in a fresh batch of CSF analysis results that were, predictably, nonspecific, elevated protein, mild pleocytosis, consistent with inflammation but offering no causal pathogen. The petechial rash, unnoticed by them, was a crucial, overlooked sign. The next few hours were brutal. Yael's vital signs, previously unstable, began a precipitous dive. Her SpO2 dipped dangerously, demanding immediate intubation and mechanical ventilation. Her blood pressure fluctuated wildly, requiring escalating doses of vasopressors. A new, more disturbing symptom emerged: multifocal myoclonus, uncontrolled jerking movements that spasmed across her limbs, a sign of widespread cortical irritability. The delicate dance of her brain was spiraling into chaos. Her EEG is showing generalized epileptiform discharges, a resident cried, eyes wide with alarm. We're loading her with phenytoin, but it's not breaking. Increase the propofol drip. Tanaka barked, his face now etched with genuine panic. We need to induce burst suppression. Her brain is literally seizing itself to death. The situation was emergent. Yael's pupils, once reactive, were now sluggish, unequal. Her brainstem reflexes, a critical indicator, were dimming. The room was a whirlwind of activity, nurses and residents scrambling, the rhythmic beeping of monitors accelerating into a frantic cacophony. Zara, her hands moving with practiced efficiency to assist with securing lines and adjusting medications, felt a surge of adrenaline, cold and sharp. This was it. This was the moment. They were losing her. And they were still attacking the problem from the wrong angle. The conventional immunosuppressants were like trying to douse a raging inferno with a garden hose, while also ignoring the source of the fire. Doctors, Zara's voice cut through the rising clamor, stronger this time, imbued with an unshakable certainty. I believe this is progressive neuro-autoimmune vasculitis. Her words were met with a stunned silence as the flurry of activity briefly halted. All eyes turned to her, a rookie nurse daring to interrupt a chief of neurology in a crisis. Dr. Tanaka's face darkened, a vein throbbing in his temple. Nurse Kimani, now was not the time for speculative diagnoses. We have a critically unstable patient. But the pattern, Zara pressed on, undeterred, the rapid decline, the lack of response to systemic immunosuppression, the diffuse neurological signs, even the subtle rash, it's consistent. We need to consider intrathecal plasmapheresis. Systemic plasmapheresis won't cross the blood-brain barrier effectively enough at this stage. We need to directly remove the pathogenic antibodies from the cerebrospinal fluid. Perez finally looked up, his expression a mixture of disbelief and annoyance. Intrathecal plasmapheresis? Nurse, do you have any idea how delicate that procedure is? The risks of direct CSF manipulation, especially in an acutely unstable patient with increased ICP, are astronomical. And it's an unproven therapy for this specific presentation. It's been done, successfully, in rare, rapidly progressive neuroautoimmune conditions where conventional therapy has failed, Zara countered, her gaze unwavering, remembering her remote field clinic's desperate, successful gamble. It's the only way to directly target the pathogenic factors within the CNS before irreversible damage occurs, and given the refractory status epilepticus and signs of impending brain herniation, we are rapidly running out of time for less invasive options. Tanaka scoffed, a humorless sound. Nurse Kimani, your enthusiasm is commendable, but you are a nurse, not a neurologist. We have exhausted all viable options for a diagnosis and treatment. Dr. Abramov is in refractory status epilepticus, showing signs of impending brain herniation. At this point, further aggressive interventions are futile and merely prolong suffering. We are moving towards palliative care. The declaration hung in the air, a death knell. Palliative care. Give up. Let a brilliant mind fade into oblivion, all because their vast knowledge couldn't encompass the fringes of medical rarity, the subtle anomalies that lay just beyond the well-trodden paths. Zara felt a cold fury. They were sealing Yael's fate, dismissing the one path that offered hope, simply because it didn't fit their established protocols or their perception of who could offer a solution. Yael Abramov, the woman whose work promised to revolutionize medicine, was being condemned to die, not by the disease alone, but by the arrogance of expertise. Zara's conviction, once a quiet whisper, now roared within her. She wouldn't let it happen. Zara's quiet resolve solidified. She thought of Yael's research, the countless lives it could save. With all due respect, her voice cut through the somber pronouncements. Dr. Abramov's symptoms align precisely with progressive neuro-autoimmune vasculitis. Intrathecal plasmapheresis is the only viable treatment. Tanaka scoffed. Perez merely raised an eyebrow. They dismissed her, a rookie challenging their collective wisdom. But her unwavering conviction, the sheer force of her belief, left an uncomfortable silence in its wake. Will Zara, the underdog, be able to convince them? Will her unique insight win against the giants of medicine? If you're rooting for the overlooked hero, make sure to hit that subscribe button and follow Zara's fight against the odds. The declaration of palliative care had barely faded from the air when the first alarm shrieked. A sharp, piercing tone from the bedside monitor, cutting through the sterile silence like a surgeon's scalpel. Dr. Abramov's vital signs, already precarious, plummeted. Bradycardia. Dr. Perez barked, his voice laced with sudden panic, pointing at the monitor where Yael's heart rate was crashing, dipping below 40 bpm. Epinephrine, 1 mg 4 push. Dr. Tanaka roared, already at the bedside, his earlier arrogance melting away, replaced by the instinctual urgency of a seasoned physician facing a code. The resident scrambled, vials clinking. But it was too late. Before the epinephrine could even be drawn, a flat line replaced the erratic cardiogram. The monitor screamed, a long, continuous tone of absolute despair. Asystole. She's in asystole. Zara cried out, her own heart lurching. The room erupted into controlled chaos. Dr. Tanaka immediately initiated chest compressions, his powerful hands pressing rhythmically, forcefully, against Yael's sternum. Dr. Perez was already bagging Yael, ensuring airway patency, though her spontaneous respirations had ceased. Code blue. Room 3, a nurse yelled into the intercom. More personnel flooded in, a rapid response team mobilizing around the bed. A crash cart was wheeled in with a jarring thud. Defibrillator paddles were charged, then pressed to Yael's chest, but the monitor showed no electrical activity, rendering the shock futile. No rhythm, the resident announced, her voice trembling slightly. Still asystole. Another round of epinephrine. Atropine 1 mg 4. Tanaka commanded, sweat beading on his brow as he continued compressions, his face grim. We need to get a pulse back. Get her on vasopressors. Minutes stretched into an eternity. The relentless thud of compressions, the sharp whoosh of the ambu bag, the urgent calls for drugs, it was a symphony of last-ditch efforts. But Yael's pupils were fixed and dilated, her body unresponsive to the desperate interventions. Her brain, deprived of oxygen, was fading. The signs of impending herniation, mentioned by Tanaka earlier, were now becoming stark reality. Her brainstem reflexes are gone, a nervous resident reported, having quickly assessed. No gag reflex, no pupillary light response. Tanaka paused compressions briefly, checking for a pulse, then shook his head, resuming the arduous task. His movements were growing more labored, his face a mask of defeat. Perez, usually so composed, looked utterly lost, his brilliant diagnostic mind stumped by the ultimate failure. They were throwing everything they had at the symptoms, but the root cause, the insidious neuro-autoimmune vasculitis, was impervious to standard ACLS protocols. It wasn't a primary cardiac event, it was a brain succumbing to systemic autoimmune attack, leading to global organ failure. We're losing her, Perez whispered, his voice hoarse, staring at the flat line. There's nothing else we can do. The words hung heavy in the air, a final surrender. The room's energy, once frantic, began to deflate, a collective slump of shoulders, a silent admission of defeat. The code blue was nearing its end. It was in this moment of utter desolation, when the most brilliant minds in neurology had given up, that Zara stepped forward. Her heart pounded, a drum solo against her ribs, but her voice, though strained, was clear and firm, cutting through the heavy air of resignation. "No," she said, her voice louder than she intended, drawing all eyes. Tanaka and Perez looked at her, startled, then dismissive. "You're wrong. There is something else. And you're letting her die for nothing." Tanaka, breathless from compressions, glared at her. "Nurse Kimani, this is not the time for insubordination. We have exhausted every viable treatment protocol. Dr. Abramov's brain is irrevocably damaged." "No, it's not." Zara's voice trembled with conviction, but her gaze was steady, meeting Tanaka's. "Her brain is inflamed. It's being attacked by her own immune system, destroying the blood vessels that feed it. Every intervention you're attempting is treating the symptoms, not the underlying pathology. This isn't a cardiac arrest from a heart attack, Dr. Tanaka. This is a complete systemic collapse due to progressive neuro-autoimmune vasculitis with cerebral involvement, leading to refractory status epilepticus and now, neurological death." She took a deep, shaky breath, her eyes flicking from Tanaka to Perez, then to the flatlining monitor. "Standard ACLS won't work because her brain is suffocating under an autoimmune storm. What she needs is intrathecal plasmapheresis. We need to clear the inflammatory cytokines and autoantibodies directly from her cerebrospinal fluid. Right now." A stunned silence fell over the room, broken only by the steady, futile beeping of the monitor. The residents exchanged bewildered glances. Intrathecal plasmapheresis? It was an experimental, incredibly delicate procedure, rarely performed, especially in such a critical state. Intrathecal plasmapheresis? Perez scoffed, but his voice lacked its usual bite, tinged with a desperate curiosity. "Nurse, that's an incredibly invasive procedure. It's highly specialized, fraught with risks, and requires precision that only a neurosurgeon or highly trained interventional neurologist can perform. Furthermore, to attempt that now, in the midst of a neurological arrest, without full diagnostic confirmation, it's madness. Madness is letting a brilliant woman die when there's a chance to save her, however small, simply because it's outside your comfort zone or your understanding of rare conditions." Zara shot back, her resolve hardening. "I've seen this before. In the field. Not as advanced, but the progression is identical. Standard treatments fail. The only thing that stopped it was intrathecal plasmapheresis." Tanaka finally paused compressions, leaning heavily on the bed, panting. He looked at the flatline, then at Zara, his eyes narrowed, searching. There was something in her fierce conviction, her unwavering certainty, that resonated with the raw desperation in the room. They had nothing left. Absolutely nothing. And who precisely, Tanaka asked, his voice strained, would perform this intrathecal plasmapheresis? He cast a skeptical glance around the room, knowing full well none of his team, himself included, had ever performed such a procedure intrathecally. Peripheral plasmapheresis, yes, but not directly into the subarachnoid space. Zara met his gaze, unflinching. "I will. With your assistance. I've assisted with this procedure multiple times. I know the protocol. I know the risks. I know exactly how to access the intrathecal space and initiate the exchange safely, even with the inherent risks of a critical patient." She wasn't just suggesting anymore, she was declaring. Her humble demeanor was replaced by the quiet authority of someone who held a critical, life-saving piece of knowledge. Perez stared at her, then at Tanaka. Their eyes, though filled with doubt and the instinctual resistance of hierarchical pride, also held a flicker of something else, utter, abject helplessness. Yael Abramov was dead unless something utterly radical was done. And this rookie nurse, whose quiet observations they had dismissed, was offering that radical solution. Tanaka looked at Yael's still form, the flatlining monitor. The silence pressed in, heavy and suffocating. His Nobel laureate patient, the pride of the Aurelius Medical Center, was gone. And he had failed. They had all failed. What did he have to lose? "Explain it," Tanaka commanded, his voice gruff, the last vestiges of his arrogance crumbling under the weight of his failure. "Explain the exact procedure. The equipment. The steps. Every single detail. Zara didn't hesitate. We need a specialized lumbar puncture kit, but for high-volume exchange. We'll require a specific membrane filter system for the CSF exchange, and a precisely calibrated pump to manage the infusion and aspiration rates. Given her current state, we'll need extreme vigilance regarding intracranial pressure fluctuations, maintaining her airway, and hemodynamic stability during the procedure. Sedation will be minimal, given her current state, but local anesthetic at the puncture site is critical. She continued, rapidly listing requirements, procedures, and potential complications with an unnerving confidence. She outlined the risks of spinal cord injury, infection, bleeding, and pressure changes, but also the vital necessity. She spoke not as a rookie nurse, but as an expert clinician. Perez's jaw was slack. Tanaka, listening intently, could find no flaws in her precise, detailed explanation. The medical jargon she used was accurate, the steps logical, the risks duly noted. It was the complete, concise plan of someone who truly understood the intervention. Fine, Tanaka bit out, his voice raw with capitulation. But if anything goes wrong, Nurse Kimani, the responsibility lies squarely with you. It was a threat, a caveat, and a desperate plea all rolled into one. Agreed, Zara said, not flinching. She knew the stakes. Dr. Perez, you handle her airway and hemodynamics. Dr. Tanaka, I need your steady hands for positioning and monitoring neurological changes. We need to clear the room to minimize contamination risk. Give me a sterile lumbar puncture tray, a CSF exchange filter system, and the smallest gauge access needles you have. Now. The shift in authority was palpable. The chief of neurology and the brilliant diagnostician were now taking orders from a rookie nurse. But there was no time for pride. Yael Abramov was on the precipice of irreversible brain death. It was the riskiest gamble of their careers, a desperate last-ditch effort against impossible odds. But it was the only choice left. The room, once resigned to failure, now thrummed with a new, terrifyingly fragile hope. The turning point was here. The sterile field shimmered under the harsh operating lights, a solitary island of pristine white in a room suddenly devoid of its usual bustling chaos. The usual retinue of residents and nurses had been cleared, leaving only Zara, Dr. Tanaka, and Dr. Perez in a tableau of stark, high-stakes drama. The rhythmic beat-boop of Yael's cardiac monitor was a relentless, chilling metronome counting down to an unknown end. Dr. Perez continued to monitor her vitals, especially her oxygen saturation and blood pressure. Maintain an arterial line for continuous pressure monitoring, Zara commanded, her voice steady, betraying no hint of the hurricane raging within her. Dr. Tanaka, once I have the landmarks, I'll need you to ensure absolute stillness in her position. Even the slightest shift could be catastrophic. Tanaka, stripped of his usual imperious demeanor, simply nodded, his face grim. Perez, too, was surprisingly subdued, his analytical mind now wholly focused on the cascade of numbers scrolling across the monitors. The air was thick with a new kind of respect, born not of hierarchy, but of sheer, undeniable necessity. Zara began with practiced precision. She meticulously scrubbed the area around Yael's lower back with an antiseptic solution, working outward in concentric circles, repeating the process 3 times with different swabs. Her movements were fluid, economical, each action imbued with a purpose honed by countless hours in makeshift clinics where every sterile supply was a luxury. She draped Yael with sterile cloths, creating a window to the lumbar spine, a sacred gateway to the very essence of her central nervous system. Local anesthetic, please, Zara requested, holding out a hand. Perez, automatically, handed her a syringe pre-filled with lidocaine. Zara took it, her fingers brushing his. His eyes, usually sharp with judgment, now held a flicker of something akin to curiosity, perhaps even apprehension. She injected the anesthetic with exquisite gentleness, forming a small wheal on Yael's skin at the designated interspace, L4/L5, a common site for lumbar puncture. This will sting a little, Dr. Abramov, she murmured, a habitual, comforting phrase despite Yael's unconscious state. She waited a moment for the anesthetic to take effect, then gently palpated the bony prominences of Yael's spine, her fingertips tracing the delicate landscape of vertebrae and ligaments. "Dr. Tanaka, I need her to be absolutely still, knees tucked slightly, spine perfectly flexed," Zara instructed, her eyes fixed on the target site. Tanaka leaned over, adjusting Yael's position with surprising delicacy, his large hands supporting her frame. He watched Zara's slender fingers, noting the almost surgical precision of her palpation. He had performed countless lumbar punctures, but rarely with this level of almost reverent focus. "The smallest gauge access needle, Dr. Perez," Zara prompted, her hand outstretched again. Perez handed her a fine, long spinal needle, glinting under the lights. It was a 25-gauge needle, exceptionally thin, minimizing trauma but demanding absolute accuracy. Zara took a deep breath, her own heartbeat a steady drum in her ears. She visualized the anatomy beneath the skin, the layers of tough ligament, the delicate dura mater, the subarachnoid space swimming with cerebrospinal fluid. This wasn't just a procedure, it was a conversation with the body, a precise negotiation. With an unwavering hand, Zara inserted the needle squarely into the interspace, aiming for the midline. Tanaka and Perez watched, their breathing shallow, their minds racing. They had seen many doctors, even brilliant ones, falter at this crucial juncture. A slight tremor, an unsure hand, could lead to a dry tap, a bloody tap, or worse, nerve damage. But Zara's hand was utterly steady, a testament to years of forced self-reliance in remote settings where failure was not an option. The needle advanced. Zara felt the subtle resistance of the supraspinous and interspinous ligaments, a faint grating as it passed through the tough ligamentum flavum. Her eyes were half closed in concentration, her brow furrowed. She wasn't relying solely on sight, she was feeling, listening to the tactile language of the tissues. Perez's eyes darted between Zara's hands and the cardiac monitor. Yael's vitals remained stable, but the air in the room grew heavier with unspoken tension. Tanaka leaned closer, his skepticism slowly giving way to a grudging admiration for the sheer confidence in Zara's movements. This wasn't the clumsy attempt of a rookie, it was the assured mastery of a seasoned expert. "Almost there," Zara murmured, more to herself than to the doctors. She felt the distinct pop as the needle pierced the dura mater and arachnoid, entering the subarachnoid space. A gasp, almost imperceptible, escaped Perez. Tanaka's eyes widened slightly. Zara withdrew the stylet. A single, clear drop of cerebrospinal fluid, like a perfect diamond, welled up at the hub of the needle, then began to flow, slow and steady, into the collection tube she held ready. It was clear, untainted by blood, a perfect tap. The silence that followed was profound, broken only by the rhythmic beeping of the monitors. Perez blinked, then looked at Tanaka, whose jaw had subtly dropped. They had witnessed hundreds of lumbar punctures, some expertly done, some struggling. But this was artistry. The smallest needle, the first attempt, and a perfect, clean flow. Remarkable, Tanaka finally exhaled, the word barely a whisper. He looked at Zara with a new, dawning understanding. This was no ordinary nurse. Zara, however, ignored their astonishment. Her focus remained absolute. "Dr. Perez, hand me the CSF exchange filter system and ensure the sterile tubing is primed," she instructed, her voice still calm. "We need to connect this without introducing any air or contaminants. Dr. Tanaka, maintain her position, no movement. This next part requires even greater stability." Perez, still slightly dazed, moved to retrieve the specialized equipment, his movements a little less assured than Zara's. He had conceptualized this procedure, but Zara was executing it, transforming a theoretical solution into a tangible, life-saving reality. The filter system, a complex array of tubes and membranes designed to selectively remove harmful antibodies from Yael's cerebrospinal fluid, was carefully unsealed. Zara, with meticulous care, connected the tubing from the spinal needle to the filter system, ensuring every connection was tight and air-free. The clear CSF began its slow, steady journey through the intricate network of the filter, a silent prayer for Yael's recovery flowing with it. The first, most precarious hurdle had been cleared. Spinal access, perfect and precise, had been achieved. Now, the delicate dance of exchange could begin. The room, once steeped in resignation, now vibrated with a fragile, almost unbelievable, hope. The rhythmic, almost imperceptible pulse of the filter system filled the strained silence, a testament to the intricate ballet of life and death unfolding. With the spinal needle perfectly seated in the subarachnoid space, Zara's focus narrowed to the transparent tubes. The initial outflow of CSF, stained faintly by the destructive proteins it carried, flowed into the filter. This was the first, crucial step of exchange. "Keep a close eye on the pressure transducer, Dr. Perez," Zara murmured, her voice steady despite the monumental task. "We need to maintain a consistent intracranial pressure. A sudden drop could lead to cerebral herniation, an increase to catastrophic damage. The flow rate must be meticulously balanced." Perez, now operating with a newly discovered humility, nodded, his eyes glued to the digital readouts. The numbers flickered, providing a real-time window into the delicate balance within Yael's skull. Zara began the second phase, the rain fusion. Slowly, methodically, the clean, antibody-depleted cerebrospinal fluid was returned to Yael's spinal canal. It was an art of titration, a constant microadjustment of inflow and outflow, ensuring no rapid shifts in fluid volume or pressure that could destabilize the already critically compromised patient. Tanaka, initially a silent, rigid observer, found himself drawn into Zara's orbit of intense concentration. He watched her nimble fingers, her eyes scanning the array of monitors, heart rate, blood pressure, oxygen saturation, end-tidal CO2, and the critical CSF pressure. Every 3 minutes, she would lean in, her ear near Yael's mouth, listening for the shallow, ragged breaths, checking the subtle changes in the rhythmic rise and fall of her chest. There was a holistic understanding at play, a synergy between technology and instinct that few practitioners possessed. The first 15 minutes felt like an eternity. Then 30. Then an hour. Each drop of filtered CSF returning to Yael was a tiny victory. The initial readings remained precarious, a high-wire act of medical intervention. Yael's blood pressure wavered, her heart rate occasionally dipped, sending a jolt of fear through the room. Each time, Zara would make a minute adjustment to the exchange rate, or instruct Perez to prepare a small bolus of vasopressor, anticipating the body's response with an uncanny prescience. "Her systemic inflammatory markers are still high, Zara," Perez reported, his voice tinged with anxiety as he glanced at the latest lab results, rushed in from the adjacent lab. "And her peripheral tremors are still present, though perhaps less pronounced." Zara nodded, not taking her eyes off the fluid levels. "The systemic response will take time to subside, Dr. Perez. We're targeting the central nervous system directly. We need to watch for the neurological signs." Her pupils, she paused, lifting an eyelid with gentle precision, shining a penlight. "Still sluggish, but reactive. That's a start." Suddenly, the CSF pressure monitor registered a subtle, but concerning spike. The rain fusion pump's alarm gave a soft, almost polite beep. Perez's head snapped up. Tanaka tensed, his hand instinctively going to the crash cart. "It's a microspasm," Zara stated calmly, her voice cutting through the rising tension. "A transient arterial constriction in the lumbar region, likely a stress response. If we continue the current infusion rate, it will cause an acute rise in intracranial pressure." Without hesitation, Zara's left hand, steady as a rock, adjusted the inflow valve to slightly reduce the rate, while her right hand, with a practiced grace, massaged a specific point just above Yael's sacrum. It was a precise, almost esoteric maneuver, drawing upon her deep knowledge of neuroanatomy and peripheral nerve response, something entirely outside standard textbook procedure for intrathecal plasmapheresis. Perez blinked. "What did you just?" Before he could finish, the CSF pressure readings began to normalize. The subtle surge receded, and the pump alarm silenced itself. The room exhaled. Tanaka, who had witnessed countless crises in his career, was speechless. This wasn't just skill, it was an intuitive, almost clairvoyant understanding of the human body under duress. Her previous condition, the Neuro-Autoimmune Vasculitis in the field, it presented with similar transient vasoconstrictive episodes, Zara explained softly, her gaze still fixed on the fluid dynamics. The peripheral stimulation helps to override the localized spasm, preventing a dangerous spike in pressure. It's a trick I learned from a traditional healer, adapted to modern physiology. The admission hung in the air, a stark contrast to the elite, evidence-based world of Aurelius Medical Center. Yet, the undeniable result was right there on the monitors. As the second hour drew to a close, the changes in Yael became more pronounced. The faint tremors that had plagued her limbs for days seemed to lessen, her breathing became shallower but more regular. The pallor in her face, though still present, gave way to a less ashen hue. Her pupils, when Zara checked them again, were reacting more briskly to light. "The CSF is clearing," Perez said, his voice hushed with wonder, pointing to the outflow tubing where the fluid now ran almost perfectly clear, devoid of the milky opalescence seen earlier. "The antibodies, they're being removed." Zara offered a small, tired smile. "It indicates the filter is working effectively, Dr. Perez. And more importantly, that Dr. Abramov's system is responding." Finally, after nearly 3 hours of grueling, concentrated effort, the predetermined volume of CSF exchange was complete. Zara meticulously clamped the tubing, her movements still precise and unhurried. "End of procedure," she announced, her voice a whisper of relief and exhaustion. With extreme care, she withdrew the spinal needle, applying immediate pressure to the insertion site, then dressed it with a sterile, occlusive dressing. The delicate intrathecal plasmapheresis was over. Tanaka and Perez stood frozen, their eyes fixed on Yael. Her vital signs were stabilizing, the previously erratic heart rate settling into a calmer rhythm, blood pressure holding steady. The frantic, almost desperate energy that had permeated the room for days had dissipated, replaced by a profound sense of quiet awe. "She's stable," Tanaka finally managed to stammer, his voice devoid of its usual arrogant edge. He walked over to Yael, gently checking her pulse, then her pupils, his movements hesitant, almost reverent. "Her pupils are equal and reactive. Better than they've been in days." Perez, his face a mixture of disbelief and dawning realization, turned to Zara. "Zara, that technique, the precision. I've never seen anything like it. Not even in simulations." His usual overconfidence had crumbled, replaced by an open, unvarnished admiration. "You saved her. You really did." Zara, ever humble, merely wiped a bead of sweat from her brow. "We saved her, Dr. Perez. It was a team effort. You had the theoretical knowledge, Dr. Tanaka provided the resources." But her words rang hollow to the two seasoned neurologists. They knew, without a shadow of a doubt, who the true architect of this victory had been. They had witnessed not just a procedure, but a performance of unparalleled medical intuition and skill. The rookie nurse, Zara Kimani, had just accomplished what two Nobel hopefuls could not. The hierarchy of Aurelius Medical Center, for a fragile, precious moment, had completely inverted. The sterile silence of the OR was punctuated only by the rhythmic beep-beep-beep of Yael's monitor, a sound that had been a harbinger of doom moments ago, but now sang a melody of stability. Dr. Perez's words, "You saved her. You really did," hung in the air, a profound confession from a man whose brilliance often eclipsed his humility. Dr. Kenji Tanaka, chief of neurology, remained rooted beside the operating table, his gaze fixed on Zara. His usual authoritative posture seemed to have deflated, his shoulders subtly slumped. The furrow in his brow wasn't one of annoyance or skepticism anymore, but of deep introspection. He watched as Zara meticulously tidied her instruments, her movements economical and precise. Even in the aftermath of such a monumental feat he had dismissed her, scorned her, and in his arrogance, nearly cost a Nobel laureate her life. The weight of that realization was crushing. Finally, he spoke, his voice unusually quiet, stripped of its typical condescension. "Nurse Kimani." "Zara." He corrected himself, a subtle but significant shift. "What you did, it was extraordinary. Beyond anything I've witnessed in my career. The speed, the unerring accuracy under pressure, where did you learn that?" His question wasn't merely rhetorical, it was born of genuine, bewildered curiosity. Zara, gathering the discarded sterile drapes, paused. "Field experience, Dr. Tanaka," she said simply, avoiding his direct gaze. "Remote areas. Limited resources. You learn to make every movement count." Perez, recovering from his initial shock, interjected, "Limited resources?" "Zara, that was a spinal access that required micromillimeter precision. A millimeter off, and you could have caused permanent damage, or worse, exsanguination into the CSF space. And you did it blind during a cardiac arrest, based on what? Just your clinical judgment?" Zara finally looked at them, a faint blush rising on her cheeks. "The clinical presentation, Dr. Perez, was identical to a cluster of cases I managed in the Ngorongoro Conservation Area during a medical outreach program. Similar rapid-onset inflammatory neurological decline, unresponsive to conventional immunosuppressants. They were identified eventually as a regional variant of what you call progressive neuro-autoimmune vasculitis. We didn't have advanced imaging or sophisticated lab diagnostics. You learn to read the CSF pressure changes, the subtle tremor patterns, the specific nystagmus, to feel for the correct intervertebral space." She gestured vaguely. "When Dr. Abramov's vital signs plummeted and the status epilepticus began, it was a cascade I'd seen before. The tremors, the exact vertebral location, it was imprinted in my muscle memory." Tanaka stared, processing. Ngorongoro. Remote. His mind, accustomed to the gleaming, high-tech world of Aurelius, struggled to reconcile the image of cutting-edge neuroscience with makeshift clinics in the African wilderness. "You performed intrathecal plasmapheresis in the field?" he asked, incredulous. "A rudimentary form, yes," Zara confirmed. "We used a modified protocol, adapting available intravenous lines and peritoneal dialysis kits. It was innovative. And often, our only chance. The conditions were aggressive, and transport to a fully equipped center was rarely an option." Her voice was devoid of boastfulness, merely stating facts. The implications of her revelation rippled through the room. Tanaka and Perez, who prided themselves on their theoretical knowledge and technological prowess, were confronted with a different, perhaps more fundamental, form of medical expertise. Zara hadn't just read about these conditions in textbooks, she had lived them, battling them with ingenuity and raw skill in the most challenging environments. Her hidden expertise was not merely academic, it was forged in the crucible of extreme necessity. A junior resident, Dr. Anya Sharma, who had been assisting in the OR, stepped forward tentatively. Her eyes, wide with admiration, never left Zara. "Nurse Kimani. I've been researching the Ngorongoro outreach programs for my global health elective. I recall reading about a particularly successful, though unconventional, neurological intervention project led by Zara K., specializing in atypical neuroinflammatory conditions. Was that you?" Zara offered a small, shy smile. "That was me. We had a small team. Very dedicated." Tanaka, his initial shock giving way to a profound sense of awe, finally walked over to Zara. He extended a hand, a gesture of respect he rarely offered to anyone, let alone a junior nurse. "Zara, you are truly exceptional. Your skills aren't just precise, they're instinctual, honed by experience most of us can only imagine. I owe you an apology for my dismissiveness." "We all do." His voice cracked slightly on the last words. "You saw what we, with all our advanced degrees and privileged access, could not. You saved Dr. Abramov." Perez clapped Zara gently on the shoulder. "He's right. My overconfidence nearly led to a tragic outcome. You had the courage to speak up, the conviction to stand your ground, and the unparalleled skill to execute when it mattered most. Thank you." His smile was genuine, free of competitive edge. Over the next few hours, as Yael's neurological status steadily improved, her Glasgow Coma Scale score climbing, the tremors subsiding, and even a flicker of awareness returning to her eyes, the news of Zara Kimani's heroic intervention spread like wildfire through Aurelius Medical Center. The hushed whispers in the corridors quickly turned to open discussions. Nurses, long accustomed to their contributions being overshadowed, exchanged knowing glances of pride. Junior doctors, previously intimidated by Tanaka and Perez, found a new role model in Zara, a testament to the power of clinical acumen and compassionate persistence. Dr. Eleanor Vance, the hospital administrator, personally sought Zara out as she was meticulously charting Yael's improving vitals. Nurse Kimani, Vance began, her voice a blend of relief and professional intrigue. I've just received a preliminary report from Dr. Tanaka and Dr. Perez. They've detailed your pivotal role. And I've taken the liberty of reviewing your personnel file more thoroughly. Zara's heart gave a slight flutter, wondering if her unconventional background might now be seen as a liability. Vance continued, a rare smile gracing her lips. Your previous work in sub-Saharan medical outreach, your leadership in establishing neurological protocols for rare, endemic conditions with severely limited resources, it's astounding. You didn't just assist, you innovated, adapted, and saved lives under conditions that would break most seasoned physicians. To have such a wealth of experience, such unique expertise, and to have kept it so quietly, why, Zara? Zara looked down at her hands. Patients in the field needed care, Dr. Vance. Here, I thought my role was to support the physicians, to learn their methods. My experience felt different. Perhaps not relevant to an elite center like Aurelius. A humble, almost self-effacing admission. Dr. Vance scoffed lightly. Relevant? Zara, you just demonstrated that your unique blend of pragmatic skill and profound clinical insight is precisely what elite centers often lack. We become too reliant on our machines, our protocols, forgetting the raw power of observation and instinct. Your presence here is an invaluable asset, not a discrepancy. The quiet recognition was more impactful than any grand declaration. Zara Kimani, the rookie nurse who had started her shift humbly assisting, was now seen not just as a competent caregiver, but as a groundbreaking clinician in her own right. She had earned the respect of her formidable superiors, inspired her colleagues, and most importantly, given Dr. Yael Abramov a second chance at life. The hierarchy had not just inverted, it had undergone a profound, necessary reevaluation. Yet, amidst the newfound attention and accolades, Zara remained steadfastly herself, modest, attentive, and utterly dedicated to the quiet art of healing. She simply nodded, a soft thank you, and returned her gaze to Dr. Abramov's improving chart, her focus already on the next phase of Yael's recovery. The immediate aftermath of the intrathecal plasmapheresis was a period of tense, cautious optimism. Dr. Yael Abramov, no longer flatlining, now lay in a medically induced coma, her vitals stabilized, but her neurological status a fragile enigma. Zara remained by her side, monitoring every flicker on the cardiac monitor, every nuanced change in her respiratory pattern, her trained eye seeking not just stability, but the first nascent signs of recovery. The complex fluid exchange had averted the immediate crisis, but the battle against the progressive neuro-autoimmune vasculitis was far from over. Post-procedure, Yael required intensive care, meticulous electrolyte balancing, prophylactic antibiotics to prevent infection at the lumbar puncture site, and vigilant assessment for any rebound inflammatory markers in her CSF. As days bled into a week, Dr. Tanaka and Dr. Perez, still visibly shaken by their near-fatal misdiagnosis, found themselves in unfamiliar roles. They were no longer the sole authorities dictating treatment, but rather, observers, collaborators, and, for the first time in their careers, students of a rookie nurse. Their initial humiliation had slowly morphed into a grudging respect, and for Perez, a profound, unsettling introspection. Tanaka, ever the chief, tried to regain some semblance of control, but his pronouncements now lacked their former assuredness, often ending with a tentative, "Nurse Kimani, your thoughts?" Zara, with characteristic humility, would offer her insights, drawing from her rare field experiences where resource scarcity often demanded a deeper reliance on clinical observation and a broader differential. She suggested a gradual weaning from the immunosuppressants once inflammation markers stabilized, advocating for physical therapy to begin even before Yael fully regained consciousness, focusing on passive range of motion to prevent contractures. Her suggestions, once dismissed, were now meticulously considered, integrated into Yael's care plan. The turning point came on the 9th day. As Zara was performing a routine neurological check, a faint flutter of Yael's eyelids, a minute withdrawal reflex to pain, sent a jolt of hope through the ICU. Within 48 hours, Yael was gradually roused from the coma. Her initial state was one of profound weakness and confusion, her motor control severely impaired. It was a stark reminder of the ravages the vasculitis had wrought, but Zara saw beyond the current deficit. She saw the potential for recovery, a spark of the indomitable intellect that had defined Dr. Abramov. Yael's rehabilitation was grueling. She began with occupational therapy to relearn fine motor skills, physical therapy to rebuild strength and balance, and speech therapy to address lingering dysarthria. Zara became her constant advocate and confidant, celebrating every minute victory, the first independent swallow, the first wobbly step with assistance, the first coherent sentence. She adapted her nursing care, devising ingenious ways to engage Yael, even bringing in articles related to Yael's research, reading them aloud, subtly stimulating her mind. She understood that full recovery meant not just physical health, but the restoration of Yael's intellectual prowess. The consequences for Dr. Tanaka and Dr. Perez began to ripple through Aurelius. While the hospital board, valuing discretion, did not publicly censure them, their authority had been irrevocably dented. Dr. Tanaka, acutely aware of the whispers and sidelong glances, became conspicuously less dismissive in staff meetings, even initiating a new protocol for consulting diverse specialists earlier in complex cases, an unspoken acknowledgement of Zara's impact. His arrogance had not vanished entirely, but it was now tempered by a pervasive caution, a fear of repeating such a public and near-catastrophic error. He found himself deferring to Zara on matters of neurological nuance, a practice that grated on his ego but ultimately benefited his patients. Dr. Perez underwent a more profound transformation. The brilliance that had once fueled his overconfidence now spurred a quest for deeper understanding. He spent hours in the medical library, poring over obscure journals, even requesting access to Zara's field notes from her time in remote clinics. He admitted to Zara, with an almost uncomfortable vulnerability, "I believed my intellect was all-encompassing. You've shown me that true diagnostic prowess lies in the synthesis of all knowledge, not just the academic, and certainly not just my own." He started collaborating more, seeking input from nurses and junior staff, fostering a more inclusive diagnostic process. The shadow of his near failure had made him not less brilliant, but significantly wiser and more collaborative. Meanwhile, Zara became Aurelius Medical Center's quiet legend. Offers poured in. The chief of nursing proposed a fast-track promotion to a specialist role, complete with research grants and a significant increase in salary. Dr. Tanaka himself, in a gesture that astonished the entire department, offered her a position as a clinical nurse specialist in neurology, designed specifically around her unique expertise. There was even a preliminary inquiry from a prestigious medical journal to publish a case study on Dr. Abramov's diagnosis and treatment, with Zara listed as the lead author. Zara, after careful consideration, politely declined them all. She met with the chief of nursing, explaining, "My purpose, my true calling, is at the bedside. I thrive on the direct connection with patients, the immediate impact of care. A promotion, while an honor, would take me away from that." To Dr. Tanaka, she expressed gratitude but reiterated, "My strength lies in observation and hands-on care. I can serve Dr. Abramov and future patients best as a direct caregiver, bringing my unique perspective to the floor, where it can reach the most people." Her integrity was absolute. She wanted to heal, not to manage or merely publish. She did, however, agree to hold regular in-service training sessions for the neurology department, sharing her insights on rare conditions and advanced neurological assessment techniques, becoming a revered, unofficial mentor. Months later, Dr. Yael Abramov, now fully recovered, walked onto a brightly lit stage in the Aurelius Medical Center auditorium. Her gait was steady, her speech clear, her eyes sparkling with their former intensity. She was presenting her groundbreaking research on quantum entanglement in neural networks, a project Zara's intervention had saved. Yael concluded her presentation with a powerful, unscripted acknowledgement. Today, I stand before you not just as a scientist, but as a living testament to the extraordinary power of observation, humility, and dedication found in the most unexpected places. My life and this work were saved by nurse Zara Kimani, whose expertise transcended conventional hierarchies. She looked directly at Zara, who sat modestly in the back row, a quiet, knowing smile gracing her lips. Zara's decision to remain a direct patient care nurse solidified her unique position at Aurelius. She wasn't an administrator, nor a chief of a department, but her opinion now carried the weight of a Nobel laureate's endorsement and the respect of the entire hospital. She was the one consulted when a diagnosis baffled the brightest minds, the quiet force ensuring no patient was overlooked, no subtle symptom dismissed. Her authentic life was one of service, grounded in the profound, often unacknowledged, art of nursing. The final, lasting impact was a subtle yet seismic shift in Aurelius Medical Center's culture. Humility gained currency, and the value of diverse experience, particularly from those on the front lines of care, was finally recognized. The nurse's insight became a new, unwritten protocol. Zara Kimani, the rookie who had challenged titans, remained steadfastly herself, modest, attentive, and utterly dedicated to the quiet art of healing. She simply nodded, a soft thank you, and returned her gaze to Dr. Abramov's improving chart, her focus already on the next phase of Yael's recovery, and indeed, on the next patient who would need her unique vision. Her quiet power had not just saved a life, it had forever changed the heart of an elite institution, proving that true expertise often whispers, rather than shouts, its profound truths. Months later, Zara watched from the back of the packed Aurelius auditorium as Dr. Abramov, vibrant and intellectually sharp, presented her groundbreaking research, a triumph made possible by Zara's intervention. As the applause died down, a frantic page echoed through the hospital's PA system. Code Blue, complex neuro case, Dr. Kimani requested immediately to triage. No longer just a rookie, Zara was now the first call, her quiet expertise a beacon. This isn't merely a story about a nurse saving a life, it's about the profound power of humility, the wisdom found in unexpected places, and the courage to speak truth to power. What resonates most with you from Zara's journey? Share your thoughts below. If this narrative inspired you, please subscribe for more stories that celebrate the unsung heroes of our world. Remember, sometimes, the quietest voices hold the most profound truths, and true healing often begins with truly listening.